And I wanted to provide a little bit of a general introduction for the excellent discussions that you're going to be hearing today from my colleagues. So what I wanted to just start with is to really recognize again that the vasculitis is not one illness by any means, and it's a family of different diseases. And this really affects all across the board people of different ages, from children to grandmothers, our brothers and sisters, our mothers and fathers. So everyone can be affected equally with these illnesses. And as we look at this, although we recognize that there are a lot of unique facets to these illnesses, what all links them is the presence of vasculitis. So certainly the first question we should have as far as, well, what is vasculitis? Because that's fundamental to what we're talking about and certainly what links all of these. And vasculitis really at its simplest core is inflammation of blood vessels. So if we look at this very schematically, as far as if we look at a blood vessel and think of this almost as a long tube that conveys our red blood cells to our tissues, and we sort of sectioned it here so you can see, again, here is the wall of the blood vessel, and here are the red blood cells that are going through that tube. When vasculitis occurs, there is inflammation of this pink vessel wall, and we can diagram this schematically by these purple circles here. And when this occurs, there's a couple of consequences that can develop. The blood vessel can become narrowed or blocked, and we can see again this thickening. And again, you can envision here that these red blood cells don't have a lot of room to be able to now reach those tissues. And that's what's providing the oxygen and nutrients to those organs. Now, another consequence is that the blood vessel can actually become thinned, and that can make it become wider, and another term for that is an aneurysm. And again, in some instances, that can become damaged sufficiently that that vessel wall actually becomes breached, so that those red blood cells can then leak into the surrounding tissue and cause bleeding that can occur. Any type of blood vessel can be affected, and blood vessels come in different shapes and sizes. And one way we kind of think about these is just like our beverages. They're small, medium, and large. So our small vessels are going to be our capillaries, and each blood vessel on the side, which is a vein, and the smallest level of arteries. Next would be the medium vessels, and again the large vessel, which is the aorta, which runs down the middle in its branches. So when we think about these, again, we see here our healthy artery here, which would be an example of a small blood vessel. Our medium blood vessels would be like those that maybe are going out to our fingers or toes. They may go out to, again, our other organs. And again, the large vessel is this one right in the middle here, and again, the branches that come off of this. Now, this can also be helpful conceptually when we talk to other doctors about this, because different forms of vasculitis tend to predominantly affect a certain size of blood vessel. Now, that's not absolute. They don't always read the textbooks, but we can tend to think about these as far as being grouped as far as large vessel vasculitis. And the most common forms of this are giant cell arteritis or Takayasu arteritis. Our medium vessel vasculitis as far as polyarteritis nodosa, Kawasaki disease, which almost exclusively affects children, and then central nervous system vasculitis, although again that's one that actually can affect different size vessels. And then potentially some of the broadest are under the small vessel category, where we see GPA, formerly Wegener's granulomatosis, microscopic polyangiitis, EGPA or Church-Strauss syndrome, IgA vasculitis, again formerly Henoch-Schönlein purpura, cryoglobulonemic vasculitis, or cutaneous vasculitis of the skin. So how do we separate these from each other and from other diagnoses? And we get clues as far as, again, what organs or tissues or blood vessels are being affected. We look for patterns in terms of symptoms, and again, what organs are affected, such as a lung or a kidney or a nerve. How are the organs being affected, and what clues we get from laboratory abnormalities. There are two main means we often use as far as trying to secure the diagnosis, and that can either be an imaging test with an arteriogram or a biopsy. Arteriograms may be useful for certain forms of vasculitis, again, mainly those affecting the large or medium-sized blood vessels. And again, what this allows us to see is either that narrowing or that widening of the blood vessel. And there are different techniques that can be used. Those include MRIs, CAT scans, or an actual injection of the dye directly into the vessel. Again, biopsies can be used for certain forms of vasculitis, and again, these need to be obtained from organs that are being affected. So again, if we see no evidence by our examination or laboratories to suggest that vasculitis is affecting an organ, we wouldn't biopsy it. But the likelihood of being able to find these abnormalities depends upon that organ site and the amount of tissue that we're able to safely obtain. And it can also be useful sometimes to rule out other diagnoses that may look similar. And of course, the approach to diagnosis will vary for each form of vasculitis. So why can it be that sometimes making a diagnosis of vasculitis can be so difficult, and why does it sometimes take such time? Part of it is that each illness and each disease can present in a variety of different ways. So it isn't all the same as far as, again, when you're talking about GPA or GCA, it isn't always the same even for an individual disease. The symptoms can vary quite a lot, and the characteristic patterns that we often look at and think about may not be present early on. The onset of symptoms for that individual may come on very fast, or they may come on very slowly. The other problem we recognize is that this is an uncommon illness. Again, say if we compare this to like high blood pressure or diabetes, vasculitis is going to rank quite a bit less common than that. And there are other illnesses that can look like vasculitis. You know, some of you may have been told early on as far as that there was a concern for cancer, which can be very frightening, of course, or an infection or other inflammatory diseases, or other causes as far as why a blood vessel might be narrowed or widened. And again, that can be sometimes tricky to be able to tell apart from vasculitis. But a precise diagnosis is important, as the treatment for vasculitis is often not simple, as all of you recognize. And it can be a problem as far as if a different diagnosis is present, we want to be able to use medications or approaches that are appropriate for that particular diagnosis. And in general, there is usually no single lab, x-ray, or biopsy that can by itself make the diagnosis. We have to put all of the information together. So once a diagnosis of vasculitis is made, what do we do then? And really, again, that's where having the discussion with the doctor is important as far as discussing what is this diagnosis about, what does it mean for me, and what are the treatment options that we have to be able to consider. And the treatment is generally based upon approaches that have undergone careful studies from different research approaches, and the doctors have had experience with and knowing that they are effective in that form of vasculitis. There are many different things that can affect the choice of the treatment, including how severe the illness is, the potential side effects of the medication, if that person has other illnesses or other medications they may be on that might interact with that. And again, the level of certain critical organ functions like the kidney or liver may affect that. And following the start of treatment, of course, it doesn't end there. And monitoring is very important in looking for side effects of the medication and also making sure that the vasculitis is improving in response to that. I want to just introduce some common terms that you're going to hear the other speakers mention today. Active disease really refers to evidence of disease-related inflammation that's causing injury to a blood vessel or a tissue. And that really forms the backbone of this term we use, remission. That indicates a point in time where there's no evidence of disease-related inflammation that's causing injury to a blood vessel or a tissue. And again, what we don't want to see, which is relapse, which is a return of that inflammation that again is causing that injury to blood vessels or tissues. And how remission and relapse is defined can vary for each form of vasculitis. So when we talk about remission, again, this often engenders a lot of questions about, what does this mean and what does this mean for me? And it can be complicated, and again, sometimes it's helpful to look at this in terms of specific examples. So if we look at what remission is as far as in the skin, this is someone's leg, and we can see here that they have a rash here. And again, this can sometimes be raised, and sometimes you will have heard the term purpura, which is a type of vasculitis rash. So when skin vasculitis goes into remission, we can see on the right, nice clear skin, so this would again be an example of that. When the kidney is affected, we take a careful look at the urine, and this is what the urine looks like under the microscope. And we can see here this tubular structure, which is called a cast, and we can see these little cylinders inside of it, and these are actually red blood cells, and this is what's called a red blood cell cast. This is a direct indicator of kidney inflammation, and so when that goes into remission, again, we see nice clear urine. We may still see a few loose red blood cells, and that can persist for some people. And then the lungs can be affected as well, and this is a picture of a CAT scan, and again, this is taken sort of straight through the chest. And some of the structures we can identify as far as denser structures, such as we see here in the middle, these are some of the heart structures, or here in the back, this is the backbone, are going to be dense, so those are white. And in contrast, the lungs, which again are filled with air, are not dense, and those are going to appear black. So again, we see here on the left this area of white where it just shouldn't be, and this is indicating that there's some inflammation in the lung. Now, it doesn't tell us what this is. This could be infection, it could be vasculitis, but again, when that goes into remission, we can see that that's gone, and we can see just nice clear lungs on each side. So some common questions that often come out about remission: how long does it take? And this is going to vary for each disease and for each person. And on average, it's generally between 1 and 6 months. So if we look at studies that have been done in GPA, the average is about 3 months. For giant cell arteritis, it may be 1 to 3 months. Is remission the same thing as cure? And the answer is no. I mean, remission is defined by what we're seeing at the current time right then. Cure really means that an illness will never return. So this is what's happening in the future. And probably the best example is, so if you have an infection, you take an antibiotic, that's going to go away and never come back. There are actually, when we think about it, not all that many illnesses that people have where there is a cure, but that does not mean that they cannot be treatable and that people cannot do well. Is treatment required for vasculitis to go into remission? And almost always, yes. There are very few forms of vasculitis that will get better on their own. There are some instances where, again, if this is triggered by a medication that we then remove, that might improve. But again, most of the ones that we're talking about today would not be expected to improve without treatment. And can a person be in remission if they're still taking medications? And the answer is yes. The current definitions that we use for remission are based solely on what's going on as far as the disease activity and not the medication status. So how can we tell if remission is present? And as we mentioned, there's no one single indicator. So we look at what symptoms is a person having. What are we seeing when we do an examination, which is why, again, going to the doctor regularly is so important, because that's part of how we get that information. What do we see on our lab results, and what do we see with different imaging tests like x-rays or CAT scans? And it's really putting all of these together that we can then determine, is remission present, or again, could there be relapse? Now, the concept of remission can often be difficult, and again, for us as physicians, we don't have the ability to look directly at tissue all the time, so we have to look at our best indicators. They are helpful, they are important, but they are not perfect. And that's why research in trying to identify better markers is so important in vasculitis. It can also be difficult because people may not feel like they used to, and they may not feel well all the time, even though the doctor is saying that they're in remission. And that's confusing, because there can be sometimes a bit of a mismatch as far as between what we call remission and how well a person feels. And that can occur for a variety of reasons. Fatigue is probably the number 1, 2, and 3 concern that we see that people can experience. Medication effects can make people not feel well. Often people don't sleep well, and that can be an effect of prednisone or other factors. Because of their illness, people may have reduced exercise or physical activity. They may have other health issues. Life can be stressful enough as it is, and again, in the setting of illness, that's going to compound things. And again, if there has been injury or damage to an organ resulting from vasculitis, that can occur. The good news is that many of these can change over time, and they can be modified by different strategies that we can have. One of the things that often is also confusing is the concept of damage. And what is damage? And if we envision this as far as a sheet of paper here, and we crumple it up, and we try and flatten it out again after that, it's still a sheet of paper. It still works, but it's not quite like it was. And that's similar as far as what we think about in vasculitis, is the function of that organ or tissue doesn't go back to working the way it used to. But damage does not always occur, and the type of damage is going to depend upon the type of vasculitis. So what are some of the keys as far as in your vasculitis care? Being proactive and trying to understand about your illness, and that's of course why all of you are here today. Do know your medications and doses. That is an important thing if you ever need to tell anyone else about that. And keep a brief written history of your illness. This can be something that you write down, or it could be an office note from your doctor, just in case you need to see a doctor who doesn't know you. You want to see your doctor regularly. Have your monitoring tests as your doctor recommends. And utilize preventive measures. So there sometimes can be medications or strategies to reduce side effects. Bone protection, because bone loss can be a concern with prednisone. The use of non-live vaccinations, and again, you should talk to your doctor before receiving any vaccine. And again, we shouldn't neglect those things that are so common in human life, as far as keeping on top of cholesterol, for women, mammography, and for all of us, colonoscopy. And to call your doctor about things that are new or that you're concerned about, and to not feel afraid as far as asking questions.